people are worried that over time, things will be taken over by the AI. There are many reasons why we choose robo at the current stage. The first one being less cuts. So within 2 weeks, the patient is able to sit on the ground. If you don't trust a doctor, go to another doctor. Take another opinion. Keep taking 10 opinions. But just don't go with the advertisement saying just one injection cures everything.
Hello and welcome to Yashoda Health Talk session where all your health related queries are answered here. Well, today we are diving into a futuristic topic. Or just wait, is it the present already? Yes, we are talking about robots in surgery. Joining our discussion today is Dr. Sunil Dachepalli, Consultant Orthopedic Surgeon and Robotic Surgeon from Yashoda Hospitals, Somajiguda. Welcome to the program, Dr. Sunil, and it's always good to have you.
Thank you, ma'am.
So before we begin, I'd like to ask you a question. If robots were to take over a part of your non-surgical life, what would that be?
That's very nice. If at all, yes, I would like to leave all my surgeries to the robo and I can relax because now what I lack is some sleep time. So that's what I think probably. But what I have seen from the AI, people are worried that over time, things will be taken over by the AI.
So completely automated?
No, it won't happen ever because, see, at the end of the day, we are all human beings and we have all the internal organs working in different way. It's very difficult for AI to substitute a doctor.
So Dr. Sunil, having years of experience in orthopedic surgery, what was your first reaction like when you heard about robotic surgery?
Frankly, when I was in UK, I was trained in doing the computer-assisted surgeries. So that was the thing at the time. We are talking about 10 years ago. So I was trained in the computer-guided knee replacements. And the robo is one step ahead of that. So robo is more like now the AI. So we also have AI integrated into that. So this is a gradual journey that happened. But if you say so, we can talk about my first computer experience. I really felt flabbergasted because I could see a sea change. See, initially, after doing 100 surgeries, they say you can be an expert. I used to do my knee replacements like left and right. So when I finished the first 100, I was so overconfident, I can say, yes, I'm really good. But when I did my first computerized surgery, I realized the precision. Then I realized that I'm still lacking in something. So using the computer or the robo, we can get back to the precision.
So precision is the main reason why surgeons prefer robotic surgery?
Well, there are many reasons why we choose robo at the current stage. The first one being less cuts. The second one, we don't have to fiddle around in the joint also, so the pain is less. And post-operatively, the most worrisome thing for the people is the pain after physiotherapy or during the physiotherapy, which is taken off by the robo. The reason being, we give full range of movements on table. So all the physio has to do is guide the patient. So within 2 weeks, the patient is able to sit on the ground. So that's how beautiful it is. So that is one thing from patient perspective. From my perspective, I want to put a joint that goes on for at least as long as possible, like, let's suppose like 30 or 40 years. The reason being, we want that the only surgery in that patient's life. We don't want revisions. Now that we have the robo, I can do precisely exactly like what the zero cuts. So why not use that?
So it's like getting a designer dress done, personalized for each body or each patient.
So yes, I can agree with you partially because when you say personalized for a particular patient or tailor-made, yes, I mean, it's on the table. Like, we give the feedback to the robo as to what size the patient's needs and all. Once we give the feedback, the robo makes a plan and then we make finer adjustments to that and we start doing that. If I may give a simple example, like, earlier days when we were kids, when we construct a house, first is we used to have a blueprint and start building the house on top of that. Then once the house is finished, then you don't like something and then you start breaking of the walls or change the color, redo. So you are building, taking off you don't like, so you are losing money.
Money, material, a lot of things.
Absolutely. And now if you see the current thing, Once you go to your architect, he gives you a 3D print. So you can walk through your future house. You can change whatever you don't like, you just change, and then you start constructing your house. So you save a lot. Similarly, robo, what we do is we mark the knee joint, feed it to the robo will give us a plan, then I start operating. So I save lot of time, and I can save lot of bone, unnecessary surgeries, and the best part is the pain. So I can give nice knee with full movements with least pain.
So, talking about robotic training, Dr. Sunil, how is it getting trained with robots? I mean, is it like learning how to drive a car, or is it like learning about how to pilot a spaceship? How is it like?
That's a nice question. Thank you. So, thing is, if at all you see, I mean, obviously, for any surgeon, we have to first observe and absorb. I know the events that go around. Now, what we suggest to all our juniors is first you be a conventional knee replacement surgeon. First, they should understand the principles of the surgery of knee replacement or whatever, whichever joint replacement. Then after that, then they have to go into robotics.
You cannot directly jump into robotic training.
Yes, that would be a disaster, because imagine if the robot stops functioning or it malfunctions, you've done more than required of bone cut or taken off unnecessary ligaments.
You wouldn't know what to do.
What do you do next? So it's like, you are sitting in a Tesla car and it stops working, you don't know driving.
It's always better to learn the manual way.
Exactly, true, absolutely. So you need to know the manual mode, then you get into autopilot car, then you can know if it stops, you can drive yourself. So always, that is what we suggest to our juniors.
So, do you train the robots or the robots train you? How would you like to answer this question?
Well, I would say the robo system is there. I give a feedback to the robo. Robo is more like a computer. What we do is we mark the knee joint and tell the robo these are the landmarks. Based on that, it makes a 3D image, like a hologram, you can say. It does a 3D image on the computer screen. And then it suggests me, this is what you have to do, like cut this much on this side. So I make my adjustments from my experience. Then I hold the robo arm and I do the cutting. And when I do the cutting, if I push it harder or exceed what is required, it stops functioning. So that is the check. So it stops functioning, so I don't have to cut more. Similarly, if at all, always we have human and robo interface. Like, if I think whatever the robo is planning is more than required, then I go a step less. I can always cut the bone more, but if I cut less, I'm in the safe zone.
There's another common myth that many of us tend to believe that most of the surgery is done by the robo and the surgeon just sits there and grabs a cup of coffee. So, how true is this?
Absolutely. I mean, I agree with you, because there are different types of robos. If you take the general surgery robo, it's like the robo is on top of the patient on the table, and you can see many arms like, octopus. Whereas in orthopedics, the robo is different. We hold the robo and we have to do the cutting. So it's almost like I'm doing everything. I'm being guided by the robo. And without me, it won't be possible. There are some robos like, fully automatic robos. You feed that. But the only problem with that is if something goes wrong, it will be a disaster. So we prefer semi-automatic robos wherein I have the control. At the same time, robo will be guiding me.
So I'm sure the ORs today, they look pretty much, they look totally different from what it was a decade ago, So how does it feel to be working in OR today with a robot? Does it feel like you're out of a sci-fi movie set or something like an Iron Man?
True. Frankly, I'm a gadget boy.
Oh,
The
you must
cars,
be
the
loving
gadgets.
it.
I always keep checking. When I was in London, I was there for 10 years. The show that I watch the most is Gadgets. And even coming back to India, there's a guy, forgot the name, but it's called Gadget Show. So I keep updated myself, and now I'm planning to buy that three-fold open phone. So I'm a gadget boy. So I really love doing all these robotics and all these things. And like you rightly said, yes, the theater is totally different now. Early days, it's just a table, and also you just wrap around the patient and all. Now you see lots of microscopes, gadgets, robots. It's really interesting because we can see further change. Especially orthopedics has evolved a lot. Early days, it's more of fixing the screws and all. But now we are bringing the function back to life. Like, recently I've operated on a guy about a year ago. Now we started climbing trees. I was flat. I was shocked when they showed me the video. So they're coming back to their normal life.
Really nice, and that's really wonderful to know that people are doing really so good even after surgery and getting back to the normal life. So, have you ever named your robo? Have you given any funny name like Chitti or something to the robo?
Absolutely. You said the right word. Actually, today afternoon as well, when I went for my lunch, my colleague doctors were asking, "Oh, here comes the chitty." So yes, that's what we call it, the robo chitty, and yeah, it's really fun operating.
So, talking about evolution in orthopedics, Dr. Sunil, how do you see the future is going to be like? I mean, do you think you're going to just sit at home, grab a cup of coffee, and do the surgery sitting at home, operating on a patient in some other country? Do you see that's the future?
Partly true, yes. But you need some human interface. That's more important. You can't just leave it to the gadgets because, like I said, each person is different. Now, even if you take heart also, sometimes you can have the heart on the right side. Rare, but still there. So if you feed the robot that heart is on the left side, it starts operating on that, isn't it? So similarly, each knee joint is different. And there should be somebody to feed to the robot, saying these are the markings. Either we do pre-operatively, like a CT scan, MRI scan, or intraoperatively by ourselves. And also, we always have a check on the robot. We can't just leave it. And also, there is a other field called arthroscopy. Okay, now with the Wi-Fi and everything coming in, so we can train. Like, I have some juniors who operate in peripheral centers. So they fall back on me saying, "Sir, we are doing now, can you guide us?" So sitting here in Hyderabad, in peripheral places like Siddipet or somewhere away, I can guide them when their monitor is seen by myself. And if they are going one step here and there, I can say, "No, turn to the left, turn to the right," and all. So yes, that's what we are doing nowadays. Obviously, this gadgets and the Wi-Fi and also your internet connectivity, all these things help a lot because if at all you have any doubt, you can contact the senior most and take accordingly advice.
No. So, despite of robotic surgery having so many benefits, also to the patient, be it the recovery time or the surgery time, but there are also a sector of people who suggest that robotics is just a fad, it's just a buzz, and it's really not worth it. So, what do you have to say about that?
Thanks for that question because we have been through this. Always there'll be two schools of thought. When somebody says something is good, or the other person can say it's bad. So first we go with what is called evidence-based medicine. So we look at the literature and we look at how many studies have been done. So far, lots of studies have been done which have shown that robotics are faring much better. Okay, and always there will be people who will be criticizing. It will be like because they can't buy the equipment or they don't know how to do. So they might just criticize. But what I see personally, since last 1 year, I've done about 450 robotic joint replacements.
Oh, wow, that's
Now,
huge.
that number is quite big, and also equally same number I've done conservative. So I have two cohorts of people that I compared, people who didn't have and who had. And I can easily say the people who had robotic are very, very happy. Their knee movements are much better and they're much more happier to have the same one on the other side. So this is my personal experience, and also we're doing shortly a paper in one of the journals as well. So yes, if it's my leg, I would get a robotic surgery. If it's my mother's knee, also I would do the same. Anybody in my family, I would blindly recommend robotic. The reason being, it has a lot more advantages than disadvantages.
That's wonderful, Dr. Sunil. So, before we wrap this episode, is there any message that you would like to tell our viewers out there as far as robotic surgery in orthopedics is concerned?
Yes, my suggestion first is please always take care of yourself. Now, having worked in London for 10 years, coming back to India, I see a sea change. Now, if I tell somebody that you need a joint replacement there, they immediately ask, the next question will be, when is my date? Majority, let's say 90%. Here in India, if I say a patient who can't walk, literally crawling comes to me and I say, you should have surgery, the next thing is, do we not have any other options? So this tells us the mindset. We are afraid of things for no reason. And this scares. And also some people try to utilize your fear. That is what we see in the market. Now we keep seeing in the magazines, news and everywhere saying just a knee injection and you don't need surgery, which is totally false. You have 4 stages in the knee arthritis. The first 2 stages can be controlled with injections. Please mark my words, it is controlled, not treated. Arthritis is an age-related thing. It's like your gray hair. You can't control it. You can only mask it with some color. Similarly, giving an injection can delay the progression of arthritis. Please remember this. And people in stage 3 and 4, you can't have an injection as a treatment. It's just like a placebo. If you're spending lakhs and lakhs of rupees, please don't waste your money. Because I know people who sold their land hoping one injection will cure. It's like a miracle. That's totally fad. So please don't fall for the words of people who are lying to you. That is my please take home message. The reason being, I see people coming to me crying that they don't have money even though they want to have joint replacement. So if you don't trust a doctor, go to another doctor. Take another opinion. Keep taking 10 opinions. But just don't go with the advertisement saying just one injection cures everything. Take care of yourself. That's most important.
So, this brings us to the end of this episode. We've seen how these incredible machines, robots, are reshaping the surgeries with precision. So, robots are here to stay and they aren't just futuristic. And let's not forget a highly trained, skilled surgeon who's behind this, making it all happen. So, don't forget to tune in for next week as well. Until then, take care and move healthy. Thank you.